So we see many people when they get enthused about re-establishing their health. And the components of this can be digestion, energy, sleep. But very frequently in terms of their metabolism and their energy, pain enters into it as a confounding variable. They have knee pain, so it's difficult for them to walk. They have hip pain, so it's difficult for them to do yoga. They have shoulder pain, so they say they can't golf. And so while we are enhancing people's metabolism, it's essential that we get people exercising. And exercising not just for the sake of it, but so that they enjoy life. So when you give people back their activities that they haven't been able to do maybe for years, they really appreciate it and they utilize it in order to maintain correct weight, help their cardiovascular fitness, and just generally sleep better after a good day's exercise. So for example, with chronic knee pain, very frequently we see this in conjunction with a sprained ankle, where there's compensation for the ankle pain that then disrupts the knee, or it can be a direct knee injury from skiing or falling or basketball. So by doing prolotherapy to strengthen the ligaments of the ankle, to do prolotherapy to strengthen the ligaments of the knee, maybe to do 3 treatments of platelet therapy to help heal the cartilage. Then all of a sudden a person has their knee back, they're able to rehabilitate to get their quad strength back and their muscle sequencing back, and then pretty soon they're hiking on the trail or jogging on the trail, and they're able to get their weight more under control, their cardiovascular fitness is helped. So physically rehabilitating chronic pain and injuries is a key component for people to re-own their own bodies and their own health.